Hello, and thank you for joining us today for this Clackamas County Emergency Operations Center update. There is a new vaccine from Johnson & Johnson, and there are many questions about the vaccine. And joining us today is Dr. Sarah Present to help us answer our questions. Hi, Dr. Present. What can you tell us about the Johnson & Johnson vaccine?
I can tell you that I am very, very excited to have the Johnson & Johnson vaccine available to us, and we have already received our first shipment of this vaccine. Having a third vaccine as an option in our public health toolbox to fight this pandemic will bring us much closer to getting back to a new sense of normal. It's really, really important that we get as many people vaccinated as quickly as we can so that we prevent ongoing transmission of this disease. We continue to prevent deaths, prevent adverse outcomes from the disease, and also to prevent the mutation to new viruses, new viral strains that may challenge these. So the faster we get people vaccinated, the faster we can get the pandemic under control. And I'm really excited that we have a third vaccine in order to help us do that.
Some say the vaccine is not as effective. Is that true?
I really would not consider that to be a true statement. So the numbers that go out about effectiveness are really looking at apples to oranges. Those numbers were derived from very different studies, different ways that they studied the vaccine. So some of the things about the Johnson & Johnson study was that it was more broad in different parts of the world with different strains of the virus that were circulating. The lower efficacy number that you may see has to do with mild symptomatic disease. However, if you look at the ability to prevent hospitalization, severe disease, and particularly death, it is just as effective. So all three of our vaccines are 100% effective at preventing death from the COVID-19 disease. And I think that that is really one of our most important goals.
Should we be choosy when it comes to getting the vaccine?
Like I said, we really want to get as many people vaccinated as quickly as we can. And all three vaccines work really, really well. Some of the benefits of the Johnson & Johnson vaccine is that it's only one dose, but there are pros and cons to scheduling for all of our vaccines that I think we've all seen. So I would say absolutely not. Please do not consider being choosy. The best vaccine for you is the one that you have the most quick access to.
Is the Johnson & Johnson vaccine already in our community? And is it enough to vaccinate everyone who wants a vaccination?
We are still struggling to have availability for everybody that's eligible for a vaccine. However, as we get more vaccine, including the new shipments of Johnson & Johnson, we're getting closer and closer to a point that everyone who wants a vaccine will have access in a timely manner. And there's even a fourth vaccine on the horizon. So if that comes through, then it will be even easier. And I see in the next few months, we're going to have significant decrease in the frustration that we've all been seeing as far as getting access to the vaccine when we're eligible. So I have my fingers crossed.
If you have more questions about the vaccines available and how to get one, you can visit our website at www.clackamas.us/coronavirus. Thank you for joining us. Please stay safe, and we'll see you next week.